Hi, I'm Joseph Pate, better known as Medicare Joe. I'm sure you've probably seen one of our educational videos on here before. Today we're talking about making Medicare simple. Simple to understand, simple to enroll, and simple to take action. Essentially, this is going to be a Medicare Explained video where we go over the parts of Medicare, when to sign up for Medicare, the two main options you'll have when getting onto Medicare, as well as why a broker is an asset in the process. So stay tuned. Welcome back again. I am Medicare Joe. I've been a licensed agent now for almost 10 years, and I initially got into the Medicare space by helping my grandparents enroll into their plan. I remember when they were first aging into Medicare, the amount of mailers that they'd get in the mail, emails, phone calls from insurance companies, and never mind every 5 minutes the commercials that play on TV. It's a very stressful time for a lot of folks. My goal with this video is to deliver all of the information that you need to make an educated decision on your healthcare within about 30 minutes. So that way it's not a long, boring video, but just enough so that way you have an understanding of how Medicare works, the two main options that you'll have when getting onto Medicare, as well as being able to make that educated decision on your own if you'd like. I started with this slide here so you can make note of our contact information in case any questions come up, as well as our website. Make sure, if you'd like, you can hit the subscribe button here, the red button. That will bring you to our YouTube channel where we have other Medicare Explained videos, Medicare Supplement videos, etc. So without further ado, let's dive into the Medicare Made Simple presentation. I always like to start off by going over the parts of Medicare and how Medicare can work. So there's 4 parts of Medicare, and all of these parts have something to do with Medicare, but they're not all Medicare. So if you'd like to start taking notes with me, that might be a good idea as well. We have Part A, that is your hospital coverage. We have Part B, that is your medical coverage. Now these two parts are actually going to make up what's called Original Medicare, or Traditional Medicare, if you will. Part C, which might be a term you've heard of, is actually called Medicare Advantage, and this is the alternative to Medicare. We're going to go over that today. And Part D is actually your prescription drug coverage. This is a standalone policy. Again, we will be going over this as well today, all of these parts. Let's start with Original Medicare and how that works. So Original Medicare breaks down into 2 parts, Part A and Part B. Now, Part A, again, is your hospital coverage. There's no premium for this if you had worked at least 40 quarters or your spouse worked at least 40 quarters. So a total of 10 years. This is free to you. Part B is your medical coverage. We call that everything outside of the hospital. This does have a premium associated with it. The monthly premium for Part B is $170.10 per month. Now this is the standard Part B premium. If your income falls below $91,000 a year if you're filing individually, or below $182,000 a year if you're filing jointly. I do have another video that talks about Part B if your income is above this threshold. If your income is above that threshold, this Part B premium will incrementally go up based on where your income falls. So at the end, I will link that video, so you'll be able to watch that if your income's above that threshold. So Part A and Part B, how do you sign up for it? Well, if you're already receiving Social Security benefits, you're going to be automatically enrolled into Part A and Part B. You're going to receive your Medicare card about 3 months before turning 65. And that Part B premium of $170.10 is going to be deducted directly out of your Social Security before you get your distribution. So essentially, this is going to be an automatic enrollment for you if you're receiving Social Security prior to the age of 65. For folks that are not receiving Social Security benefits, if you decide that taking Medicare is going to be the best option for you at 65, you must take action and enroll into Medicare. So this process will actually start 3 months before your effective date of coverage, and your effective date of coverage would be your 65th birth month. There's 3 ways that you can do this, the easiest of which is doing it online at the Social Security website, which I've listed here, and I will list it in the comment section below. Over the phone, you can call. You might have a little bit of a wait doing it that way, or in person at the Social Security office. Now, if you're not receiving Social Security, they're not going to deduct that Part B payment from your Social Security check. So you will actually be billed for this on a quarterly basis until you start to receive Social Security. So you'll be paying 3 months at a time for your Part B premium. So we already kind of hinted at this, but when does Medicare coverage actually start? So your Medicare coverage starts on the first day of your 65th birth month, unless your birthday is on the 1st. If your birthday is on the 1st of the month, your effective Medicare start date will be the month before your birth month. So I use an example here below. If your birthday is June 1st, your coverage will actually start May 1st, the month before. But for most of you who fall between the 2nd and the 31st, your effective date of coverage for Medicare is going to be the 1st of your 65th birth month. Now, I'm aware that there might be some folks in here that are still working and may still be covered through their employer plan. So a good question to ask yourself when you're getting onto Medicare is, does it make sense for me to start my Medicare at age 65? And that's a great question. I mean, if you're still working and you're covered under an employer plan, there's really a couple of options that you'll have. You can either enroll into Medicare effective right when you turn 65 and come off of the work plan or have the work plan act as a secondary, or you can actually delay your enrollment into Part B until you're ready to retire. So again, as long as you're actively working and you have coverage through that employer plan, you can delay your Part B of Medicare, avoid paying the $170 altogether until you're ready to come off of that work plan and retire. There's a couple of important factors to consider when making that decision, some of which are, number one, if there's any high out-of-pocket costs with your work plan and you want better quality, well, maybe it makes sense to start Medicare instead of the work plan. If you have a work plan that has a really high monthly premium for yourself and Medicare is going to be more affordable, well, then it would make sense to start Medicare. High cost medications, if you're taking anything high-end name brand medications, it may make sense for you to stay on your work plan to have those covered as opposed to getting onto Medicare. And then also, if there's a spouse that is not Medicare eligible yet, they're under 65, or if you have kids, a dependent on a group policy through your work, if you come off of that work plan and start Medicare, they would then have to search for other healthcare options, possibly on the private market, which can get expensive. So if you have dependents or a spouse that are dependent on your employer-based plan, it might be best to just delay your Medicare until you're ready to retire. So we talked about Medicare, when it starts, when to enroll, original Medicare, and I want to go over the exposures of if you were just to have original Medicare A and B with nothing else. So with original Medicare, again, we'll bring back this slide where you have your Part A coverage and your Part B coverage. The Part A coverage, your hospital coverage, you have a deductible per benefit period of $1,556. And think of this as it's not a yearly deductible, it's a deductible every time you have a medical event happen. And they consider a medical event from day 1 through 60. You'd have to pay a $1,556 deductible first before Medicare will pay anything at the hospital. So let's say you're hospitalized in April, you pay that deductible, then you get hospitalized again in September, you're gonna have to pay that deductible again. So it's per event. Part B, which is again everything outside of the hospital, also has a deductible, but this is a yearly deductible, and that is $233. So you would pay the first $233 for everything outside of the hospital for the year. And then after that, your deductible is satisfied. So that's a one-time deductible. However, with Part B, after you meet your deductible, you also have a 20% coinsurance that you have to pay. So a coinsurance is going to be a percentage of the bill that you're responsible for. So Medicare Part B will cover 80%. The insured you will be covering the 20% gap in coverage. So original Medicare by itself typically isn't the best route for people to go. And this leads us to the two ways that you can actually be insured when getting onto Medicare. And I say insured in reference to that because anything less than picking these two options, you're technically not completely insured with full coverage. So your two options when getting onto Medicare are going to be either buying a Medicare Supplement plan, which is also known as a Medigap policy, or enrolling into Medicare Advantage, which is also known as Part C. And this is how the two options would kind of look. Your original Medicare would be your primary, and if you chose option one, you'd be adding a Medicare Supplement plan to cover the gap, and you'd be adding a drug policy. Or you'd have just Medicare Advantage covering you for everything. One policy for everything. So this is a good breakdown. If you want to match this line by line on a piece of paper, you can't have both of these. You have to choose one side or the other. Now I'm going to go over the left side first, and we're going to come back to the right. So let's say we go the Medicare Supplement option. How that will look is you're going to have original Medicare basically covering you at 80%. Let's make this simple. And then you'd be adding a Medicare Supplement plan that's going to cover you at the 20% gap. So you're basically paying an additional premium for the Medicare Supplement plan to avoid paying any medical bills that aren't covered by Medicare. There's a lot of benefits to having a Medicare Supplement plan. One of which is there's no large out-of-pocket expenses. Because original Medicare is your primary insurance, you'll have the freedom to choose your doctor and hospital as you wish. You'll have no referrals. You're covered essentially anywhere in the United States because Medicare is a federal program. It's nationally recognized. That's your network. And you also have out-of-country emergency care as well. These plans are guaranteed renewable, so you're not re-enrolling every single year, and there's no prior authorization required by an insurance company for you to get procedures done. So with the Medicare Supplement plan, there's several options that you can pick, and if you've looked into the Medicare and You guidebook, you may have seen this chart somewhere before. The reason I've highlighted two plans here is because there's really only two options that folks will go with to suffice that gap in coverage, and that's G and N. And you'll notice that if we look down Plan G's column here, everything's covered at 100% except for this Part B deductible. If we look at Plan N, very similar except for the deductible and what's called excess charges. So I'm going to start going over Plan G first, and we'll come back to Plan N and how that one works. So with Medicare Supplement Plan G, we're going to bring back this slide again with the exposures of Medicare. You have your deductible of Medicare. That's going to be covered by Plan G, so you're not going to have to pay that. They're going to cover the full 20% coinsurance that you'd have on Part B, so you're not going to have to pay that. So with Plan G, your only cost, if you can recall from that chart, is going to be your annual deductible, which is the $233 deductible for the year. So if you had the worst year that you can imagine, that's the only thing that you're going to pay out of pocket. Now, comparatively to Plan N, you'll notice that it's very similar to G. We have just this one other row here, Part B excess charges, that has a blank coverage, and you have Medicare Part B coinsurance copayment with some asterisks. So let's talk about Plan N and how that would work. So Plan N is very similar to Plan G. Again, your deductible is going to be covered by Plan N for the hospital. The 20% coinsurance is going to be covered for Plan N. The difference with Plan N compared to Plan G is you're going to have the same deductible as Plan G would. The same $233. The difference is once that deductible is met. So let's say you meet that deductible for the year. After that, if you go to the doctor, they're going to charge you a $20 copay. If you go to the emergency room, they're going to charge you a $50 copay. So that's a per event copay. Again, this is after your initial deductible has been satisfied. Now, that's where the asterisk came into play. Let's talk about the other thing that we saw, which was Part B excess charges. So think of Part B excess charges as you have doctors that accept Medicare. 97% of doctors in the US accept Medicare. That was the latest statistic. And of those doctors that accept Medicare, you have doctors that will accept Medicare assignment, which is basically an already agreed upon amount that they're going to be paid by Medicare. 97% of doctors that accept Medicare also accept Medicare assignment. So 3% of doctors don't. And of those 3%, what they can actually do is they can charge up to 15% more for the Medicare approved amount. So let's say a doctor has a service that was approved by Medicare for $100. They don't accept Medicare assignment. They can actually charge you up to $115 for that visit. So the reason I put here that it's a minimal role in Plan N is because only 3% of doctors in the whole US charge excess charges, less than that. And if you're in any of these states listed here, doctors can't charge excess charges. So they don't actually apply on Plan N. So again, because it's so infrequent that this will happen, it's really a minimal role in Plan N and shouldn't play into too much of a decision when you're looking at Plan G versus Plan N. I want you to comment below if you have any questions between Plan G and Plan N. And again, at the end of this video, I'll link another video that goes into detail on Plan G versus Plan N in a little bit more detail for folks. But this is basically what you're looking at when you're comparing Plan G versus Plan N at a face value. Plan G has the $233 deductible. Plan N has the same deductible, but then you have the $20 copay at the doctor, the $50 copay at the ER. Again, the bottom here I made a quick note, and this is really depending on your zip code, but normally Plan N is going to be $20 to $40 less per month in premium. So if you go to the doctor less than 12 to 15 times in a year and you're okay paying the copay, Plan N can be a cost savings option, whereas Plan G is more of a convenience-based plan. So let's look how this all would look put together if we chose the Medicare Supplement option to cover us. We'd have our original Medicare at $170 a month. We'd have the Medicare Supplement plan. Again, this varies based on your zip code, and you could contact us for a no obligation quote so we could actually give you exact figures for where you are, but that differs based on zip code as well as gender. But roughly from $70 to $150 is what you're looking at for a supplement. And then the drug plan I put here about $15. Again, this can vary based on zip code and medications that you're taking. Good ballpark number for you to kind of put together some type of budget. So this is what we'd be looking at as far as a cost. And this is what we're going to be looking at as far as enrollment time. So original Medicare, we talked about that. That starts 3 months before your birth month. The Medicare Supplement plan, that starts up to 6 months before your birth month. So what that means is if you're starting Medicare in January, right, you can actually lock in premium and enroll into a supplement plan in July, effective for January. And the reason why I kind of put this in bold print here is this is the first step that you can take in your Medicare enrollment process. And you should, because these rates can always go up. They typically don't come down. And locking in your premium 6 months in advance gives you that comfort that your rate's not going to go up between when you sign the paperwork till when it begins. And also, it's something that you can just get checked off your list. There's going to be a couple of things on your list to do. This is one of them that is pretty easy just to check off, and it can be done up to 6 months in advance. The drug plan, Part D, you're going to have to wait until you're 60 days before your birth month to do this one. And the reason why that one wants to be a little bit close is we want to make sure, and Medicare wants to make sure, that your medications are as accurate as they can be before you actually pick a Part D prescription drug plan. So that's kind of the timeline of what you'd be looking at with the Medicare Supplement option. So let's go back to this screen here. We talked about the two options that you have. Let's talk about Medicare Advantage and how that actually works. So again, I put in bold red here that this is actually the alternative to original Medicare. So what I mean by that is you're still going to have A and B. You're just not actually insured by Medicare at this point. What happens is they'll take your A, your B, and they'll also take your prescription drug coverage if you're looking at those type of policies, and they're going to group them into one policy for everything. They call that a managed care organization. So you'd have one company for everything. So you'd have like a United Healthcare, Humana, Aetna. You'd have one carrier for everything put together. And you'd be insured through like an HMO or a PPO. So you'd be working within a network of doctors and hospitals. So this is very similar to employer-based coverage, where you're going to have copays at the doctor, you're going to have copays at the emergency room or at the hospital overnight. You'll have a medical out-of-pocket limit for the year of, it differs state to state, $6,700 for the year is one of those numbers that we see a lot state to state. And again, you'll have a network of hospitals and doctors that you're going to want to have to work within. So there are benefits to Medicare Advantage. One of which is the cost. With Medicare Advantage, a lot of times you're just going to have that $170.10 premium, and you're not going to have to pay any additional premium on top of that. No other cost. Your primary care doctor will be a low or no copay that you have to pay to see them. And these plans, again, typically come with prescription drug coverage. They typically come with dental, vision, and hearing benefits as well. So with Medicare Advantage plans, they're more state, even county-based, as opposed to where the supplements are a federal program that works, one specific way. The Medicare Advantage plans and the copays, your out-of-pocket limits, networks of doctors will differ state to state. And the plans that are in your zip code specifically are going to be the ones that you're going to be picking from. But the overall concept of how they work is perfectly illustrated here, where again, you're not paying any additional premium per month, but you're going to be paying copays as you use the plan for different services. So doctor visits will have a copay, diagnostic tests will have a copay, surgery, hospital stays, etc. As far as the cost, again, this is how it's pretty much going to look. You'll have your A and B, so you'll have your Part B premium of $170.10. But you're not going to have any additional premium on top of that. This is all you'll be paying on a monthly basis. As far as enrollment into Medicare Advantage, the best time to enroll is going to be 3 months before your birth month. The reason for that is you're going to actually need your Medicare card to sign up for a Medicare Advantage plan. They take the number off of that card to assign you to the Medicare Advantage plan that you want. So again, this will fall into that same window of signing up for Medicare. Once you have your Medicare card, if you're within 3 months, that's when you can sign up and pick a Medicare Advantage plan. That's a little different compared to the Medicare Supplement route, which again, that one's up to 6 months before your 65th birth month. So again, these are the two options that we're looking at. You can't have one, both. You have to pick one or the other. And I want to go over the benefits and disadvantages of both options so you can get a clearer picture. Again, we try to provide an unbiased opinion. We don't want to seem like we're tailoring one over the other. We work with both, and whoever you speak with when you're getting onto Medicare, you want to make sure they do work with both so they can give you an unbiased opinion. So again, there's a lot of benefits of going with original Medicare with a supplement. I've listed them here. Again, you can use pretty much any doctor or hospital that takes Medicare. Your primary insurance is going to be original Medicare, so they're more or less approving everything and calling the shots. There's no referrals. There's no, very low or no out-of-pocket exposure essentially, and there's no surprise bills for major services like hospital stays, surgeries, and that's why you're paying your premium every month. There are some disadvantages though as well. Again, this requires you to pay an additional premium on top of your original Medicare cost. Does not include dental, vision, hearing benefits, and it does not include prescription drug coverage. Those are going to be additional premiums that you'll have to pay if you're looking to have that coverage. As for Medicare Advantage, again, there's benefits to this as well. Again, the price, number one, there's no additional premium that you have to pay on top of original Medicare. They come with dental, vision, hearing. They come with prescription plans. They come with other extra benefits. So like over-the-counter medication reimbursement programs, gym membership such as Silver Sneakers, and other different add-ons. Plan to plan, it can vary. But Medicare Advantage, it does have its disadvantages as well. And this is something that you need to be aware of when you're getting onto one of these plans. Again, you're going to pretty much be paying co-payments for the services that you receive, and the cost for those can vary. I've listed some of those co-pays here, and just to be completely compliant, this is just a rough estimate. I'm not referencing one plan specifically, but ideally this is how it can look. You can have a $35 copay for a specialist, $90 copay if you stay at the emergency room, and usually the hospital stay is $300 a night, up to the first 4 to 5 nights. So if you have a 3-night stay, that would be a $900 bill in this example. Again, this varies state to state, and so can these copays. You have a network of doctors that you'll have to work within. So sometimes that can be restrictive to folks if you're looking to seek other specialists that might not be in the plan. Or they may be at a higher cost if you're looking at a PPO option. With an HMO, referrals may be required to see a specialist. There are PPO options in certain states which avoid those referrals. That can be limited though, depending on the state. And again, you have an up to $6,700 out-of-pocket limit if you have a bad year medically. And basically what that means is if you had a really bad year medically, if you take all of your co-pays throughout the year and you ever hit that number, at that point, you no longer pay for anything. The insurance company then covers everything for you. That number is actually there to protect you. In the event you have a really bad year medically, though, it is something you could hit. If you have a really good year medically, well, Medicare Advantage can be a good option. It really depends on how much you're going to be using it. That's really what it comes down to. One thing I wanted to note here, I put this at the very end, is if you start with Medicare Advantage and after your initial enrollment into Medicare, so let's say a year or two down the road, you become sick and you want to go to original Medicare with a supplement plan. A lot of times you have to health qualify at that point to be able to get the Medicare supplement plan. Now, vice versa, if you start with the supplement plan at 65, there's no health qualifying to pick an Advantage plan later on down the road. But if you start with Medicare Advantage, after your initial enrollment, you want to go to original Medicare with a supplement, you'll have to answer like 10 to 15 basic health questions in order to be able to be accepted into the plan. So there is some form of underwriting that has to get done there. I want to bring this slide back up, and my goal here today is for you to actually somewhat take some type of action as to what you think fits a better mold for how you want your healthcare to work. So I want you to either circle the left side or the right side, original Medicare or Medicare Advantage, to determine which plan you think is a better mold. If you chose Medicare Supplement, I want you to take that one step further, and I want you to circle Plan G or Plan N. In this way, you're technically building your own plan of how you want your Medicare to work, and that should be the goal at the end of the day, is you choosing what you want as opposed to just some insurance agent telling you what to get. And if you're still not sure, that's fine. You can ask questions in the comment section below, but you'll also be able to schedule a call with myself or one of our team members here. My number, again, is in the comment section below, and it's been on this video popping up here and there. If you're confused or uncertain, we strongly recommend this because it gives you personalized advice for your specific situation. Now, I'm going to come back to that in a little bit towards the end of the video, but I did promise that I was going to go over prescription drug coverage and how that can work. So again, if we're looking at the left side, Part D, we said that it was its own standalone product, its own standalone policy. And this can vary based on zip code as well as state. And a lot of people will ask me, well, I don't take any medications, when they're turning 65, why do I need to get a plan, or do I need to get a plan? Well, it's a good question, and we typically advise to sign up for a Part D plan when you're getting onto Medicare, because if you don't, you'll actually be charged a late enrollment penalty for every month you went without having prescription drug coverage, creditable prescription drug coverage, that is. So, and I have another video I'll link to the end of this about the Part D late enrollment penalty, but when you eventually do enroll into Medicare, if you don't take a Part D drug plan when you start Medicare, you'll be charged a 1% penalty is what it usually comes out to every month you could have had coverage but elected not to have it. And that 1% is based off of the retail cost of what the drug plan would have costed you at that time. So typically the drug plans are as low as $10, maybe even less per month based on your zip code. So we typically advise to get a drug plan just to avoid that penalty. And who knows, you may need drug coverage down the road as well, and it suffices for that purpose as well. With the drug plans, they're not your typical you pay a premium and then you pay a copay to get your medications. There's stages of how a Part D drug plan will work. And this is just a brief overview. I have videos going into more detail about Part D and how these stages actually break down, but it's made up of 4 stages. You have a deductible stage, which is where you're going to pay the cost of the medication, full retail, until that deductible is met. There's an initial coverage stage where you'll pay a copay for each medication, so similar to how it works with your employer coverage or older coverage. But once you hit a total retail cost of $4,430, which happens for folks that are taking high-end medications, you then enter the coverage gap, or what's also known as the donut hole, formerly known as the donut hole. And that's when you're paying a percentage of the medication. So you'd actually be paying 25% of the cost of the medication at this time. You will do that until you reach a total of $7,050 retail cost of medications. And that's when you'll enter the catastrophic coverage stage, where now you're only paying 5% of the retail cost of the medication. So again, the Part D stages, this is how it breaks down. In that other video I have that's on our channel, you'll see a little bit more in-depth discussion on Part D, but this is how it can work. How we can help with the drug plan, or how you're going to even want to search the drug plan, is you can either do it on Medicare.gov, or there's a link below for our Part D shopper website, which basically allows you to shop the drug plans in your zip code. And what you do is you basically will input all your medications and your pharmacy into a plan finder tool. Okay. That plan finder tool is going to calculate based on your medications, what plans are going to cover your medications best. And it's going to list them out from lowest total cost for the year to highest. And whichever one's at the top of that list may not be the lowest premium, but it's showing you the lowest cost for the year, which is what you want to look at, what not only the price for the plan is going to be, but also what your copays, etc., are going to be for the plan. How we help through that process is we can help select and enroll you into a plan. But more importantly, with these plans, you can actually change these every single year. So between October 15th and December 7th, you're able to shop your Part D prescription plan for the new calendar year. So with this one, it's important to pick the plan that best suits you now, because yes, you will be able to change it again in the fall time if your medications change for the new year. I want to put this slide up here just so folks are aware. So again, we're an independent agency, so we don't work with just one carrier or one specific company. We can work with a bunch, and we're licensed in almost 30 states now. Every day it seems like we're adding a new state based on people calling in from our videos. So this slide is to show you that we can provide an unbiased opinion. And of course, you could call company to company and get the pricing directly, or The easier method is just having an independent agent pull their quoting system up and quote all of these companies, so you can see whichever company has the best plan or the lowest price in your zip code. I want to go over a couple of questions that we get every single day just to clear the air as to what is a broker and what do I have to pay you and what do you get from this. So the most common question we'll get when we're going through consultations with clients is, do we have to pay a fee for your service? And the answer to that is no. So our service is completely free to you, the consumer. We get paid directly from the insurance companies if you find a plan that works, and we facilitate that enrollment for you. So the other question is, well, will the cost be less if I go directly to the insurance company? No, the cost is going to be exactly the same. So the prices don't change if you use an independent agent to sign you up or you call the company directly to sign up. So the benefit of a broker is essentially a free advisor in your corner helping you make an educated decision through the process. So another question is, well, how do you get paid then? What are you getting from this? So basically, as an agent or any insurance agent, we get paid a commission for bringing the business to an insurance company. The commission is the same across the board or almost the same across the board, company to company, product to product. So again, we're not biased to any one company over another. Our goal is to match you with the best possible option in your area. So let's recap what we've kind of gone over in today's presentation. We've talked about the parts of Medicare, the exposures of original Medicare, Medicare Supplement plans versus Medicare Advantage, and having to choose one of those two options. We went over prescription drug coverage, when to enroll into both plans, and why a broker can be an asset. So a lot of folks will leave this and they'll say, okay, well, this is great, but what do I do now? Where do I go from here? So I like to break this up into stages for folks. So this is stage one, viewing online content, our presentation today, you doing your own research on your end. Stage two, and at some point, everyone has to get to this, and it's different for everybody based on how much information they need before doing so. But getting enrollment advice is going to be very important for you to actually look at this more in the weeds and look at the numbers for your specific plans that you're debating on taking out. And the best way to do this is by scheduling a free consultation to discuss your specific situation. Now for us, I can't speak for everybody, but on these calls, we give away 2 free bonus items, which one is a timeline, which is more of a guide, a step-by-step enrollment sheet that will tell you what you need to do, when you need to do it, as well as a cost summary for whatever policies you're interested in for your specific zip code, which goes through exact quoting of the supplement plans, the Part D, as well as what plans are available for Medicare Advantage in your area. Once you get out of stage 2, stage 3, you want to make sure once you get onto a plan and you have this all set up, that you have an agent that is providing you with lifetime support. So basically, lifetime customer service is something that we are very keen on, which if you have any claim issues, you have any rate increases throughout the year, we want to hear from you. So we actually do an annual review every year with our clients. That's my next point. On these anniversary renewals, we're staying in touch, going over your policy, making sure it's still the best fit for you. That's important because change is always constant, and these policies, they can change all the time. So we want to make sure our clients are up to date and they have the best possible plan for them. So right now, we're in stage 2, or you're going to be nearing getting into stage 2 if you still have more research that you want to do. But if you are ready to seek enrollment advice and speak with a licensed agent, you're going to want to click the link below. And you'll be able to schedule a call that way. Or I just have my number here pop up again for our company. You can call us directly to get on our team's calendar if that's easier for you. But getting that enrollment advice is going to really put you in the driver's seat of knowing what you want and also setting you up for what you need to do and when you need to do it before turning 65. So I really hope you enjoyed our presentation here today. And if you did, please click the thumbs up button below. The way that YouTube works is when somebody's searching for one of these Medicare Made Simple or Medicare Explained videos, the more likes and comments a video has, the more likely it's going to pop up when they're searching for it. So if you did like it, please click that thumbs up button below. And if you'd like to see our other content, our other videos, click the red subscribe button. That'll subscribe you to our channel so you can see the Part D video that I was talking about, as well as the income adjustment video. And that'll also update you when we have any future videos that we post, so that way you'll get a notification. Now it's your turn. I make these videos for you. They're purely educational. So I'd love to hear what you thought of the video. If you could put a comment below giving any feedback, that would certainly help. So that way, as we make these videos, they're tailored to our audience and to their liking. And if you have a question, please also put that in the comment section below. I personally respond to those questions. I'd love to hear and answer any questions that you may have and help you through that process. Again, this is Joseph Pate, better known as Medicare Joe. I hope you've enjoyed today and have at least taken something from this video. Have a wonderful day.